Welcome to my podcast. Today I'm going to talk about another case which you could face in the clinical setting, and it could be challenging treatment and the way how to approach it. So basically, after we all was agreed, double check the patient name, date of birth, and introduce yourself. Ask the patient, what can I do for you today? So the patient might be kind of middle age or in the 60s, could present with sore, painful tongue. The patient might say, I feel that the tongue is kind of burning, I can't relate it. When I eat anything, it just feels oddly bitter, especially with sweet foods, and at sometimes I feel dry mouth. However, the patient will say that the sense of smell is fine and did not notice any other associated symptoms, say for instance, and for the eyes or any other symptom, or the nose as well. So in that case, you could probe asking specific questions about and around the area. Say, for instance, is there any history of rhinitis? Is there any history of gastrointestinal reflux? And also, you need to ask about lifestyle of the patient, what sort of food do they eat, and if they are active and fit, and also if they smoke or drink alcohol, and how much, and if there is any history of regular medication the patient that take, either prescribed or OTC. And then you will ask the patient that I would like to have quite a close look, just to find out if there is anything that could be related to the symptom. And basically the patient, when you examine the mouth, nose, eyes, nothing relevant. And you will send the patient for certain blood investigation just to double check and make sure that nothing has been missed. Say, for instance, full blood count, fasting blood sugar, thyroid function test, vitamin B1, 2, and 6, and 12, and also assess the iron level and the zinc, inflammatory marker, and celiac serology. However, all of that revealed nothing, and then you will ask the patient, I just need to do a swab or scraping just to make sure that there is no element of candidiasis, and all of that has been nabbed. In that condition, you need to exclude certain common conditions, so for instance, iron deficiency anemia, which obviously wasn't the case, candidiasis, which wasn't the case, smoking, which wasn't the case. So in that condition, you could come up with something called burning mouth syndrome, or it's called orodontia or glossodontia, where the patient might feel this sort of burning pain unexplained, and there is no evidence whatsoever for the causation of this. And this will fall under the title of chronic neuropathic orofacial pain, which can be distressful for the patient and can be very discomforting, and might the patient have other symptoms, say for instance tinnitus, dizziness. In such a situation they have vulvodynia and fibromyalgia, and it has been found that 1% it could be prevalent in the general population. However, it can reach to 30% postmenopausal women. And of course, this will lead to other behaviors and symptoms, like, for instance, anxiety, because the patient will be anxious what's going on. This could lead to depression. And of course, they can't sleep at night, which will lead to insomnia. The patient will feel tired and distressed. However, it has been shown that few only cases has been resolved, and there's a limited guide for treatment in terms of benefit. And I mean by that, of course, the neuropathic medications like gabapentin and pregabalin, and of course tricyclic antidepressant and other antidepressant. In that regard, we need to have like a multidisciplinary care, which could involve the neurologist, the pain clinic, the dentist, and the psychologist, in order to manage and treat this case or try to mitigate the symptoms that the patient may have and move forward. And of course, never underestimate the patient symptom or concern, and if they have any idea or thoughts what might be the reason for this, and also red flag them and explain if there is anything that doesn't seem right. Always come back to us and never try something by yourself. Say, for instance, the OTC, because some patient might be desperate and might go for something else to try. I hope by that I just covered this case, which I did recently, and thought to share with you just to give a knowledge and raise awareness. Thank you.